A local medical organization is getting help for its street medicine pilot program. It's providing medical help to homeless who are often forgotten. Isabella Warren reports.
A new pilot program by Mosaic Medical aims to remove barriers for homeless living in rural areas.
Street medicine is about going to people, and so what we hope it will be actually is for the consultants to really work with us and help us design this larger program for the entire region.
The program recently received $10,000 in a year of intensive consultative support from the Street Medicine Institute. The 3-person mobile clinic team has been piloting street medicine rounds across Central Oregon for nearly a year. The team includes a Mosaic medical provider, medical assistant, and community health worker to bring care to people living unsheltered.
To be able to go out to people and build those relationships and trust and know that it's not only providing them medical care, but it could be providing that lifeline to other services and maybe even eventually to housing.
They bring backpacks with medical supplies out to the streets of Central Oregon and the forests like China Hat and Juniper Ridge.
It really changes the view of healthcare when you sit by the riverbank or in the alley and just listen to someone and get to know who they are as a human, what they're up against.
Dr. Jim Withers is the founder of Street Medicine Institute and has worked with those living on the streets for 30 years. He says he's excited to be partnering with Mosaic to learn more about the diverse community in Central Oregon.
We're excited, I think, to have a community that's as, if I can say, rural as Bend is, because we're aware of the need of the smaller communities to have the street medicine model.
According to Dr. Withers, the mortality rate for those on the street is 10 times higher than the rest of the population, with a median age of death at 52.
When you're out there and you see what would have happened, or someone who would have lost their foot, someone who might have taken their own life, when you began just seeing what's out there,
trust has been broken,
and then have an answer to people that have given up hope, then it makes a huge difference.
A team from the Street Medicine Institute, including Dr. Withers, will be in Bend in October to shadow Mosaic's team, and they hope to turn Bend into an actual regional hub for the Pacific Northwest.
So what sets Bend and Central Oregon apart from some of the other areas that they've helped?
Well, Dr. Withers actually did say that we have a really diverse homeless population, so it's a mix of veterans, indigenous, and migrants who are living deep in the forest like China Hat and Juniper Ridge.
Got it. Well, it'll be great to see how it expands. Thank you, Isabel. Tonight, we're asking, do you think we need more healthcare options in Central Oregon like the mobile clinic? To weigh in, head over to our web poll on the ktvz.com homepage. Or if you have your smartphone handy, you can scan the QR code you see right here.